How do you get it through the
Governor,
legislature?
the Republican majority has essentially declared a jihad against Obamacare. Now, if they refuse to even deal with this at all, what are the consequences going to be? Because you've got to know there's a very good chance that the majority in both houses of the legislature are going to say no to this program.
Well, I think that over the last especially 25 or 30 days, as we spent significant amount of time studying and laying out what I think is the best path forward for the state, I think we've got a solid argument. I think that this is a persuasive case as to why we should move forward, and I look forward outside the context of political campaigns to move to what I think is a more constructive level of discussion about what's best for the long term of the state. And in that area, Charles, I think I remain confident that we will work together to find the best fit for the state. And I think that best fit is clearly using Missourians' tax dollars to hold down the cost of health care, to provide jobs, to provide access to health care, and also to stress with a lot of folks that the way that the disproportionate share dollars are set up right now, if we stand still and do nothing, we lose money. I mean, and I think that is, as we move forward and lay out and educate on this case, I feel that we can be positively persuasive because it's the right thing to do.
But following up on Kevin's question, you've got the leadership in both houses that are saying, look, whether it's 3%, 5%, 10%, the figure is just too daunting. Missouri can't afford it,
A whole lot of folks said stuff in the campaigns, and I think that as we move forward now, looking at all of these issues, I feel, like I said before, very solid about why this is the best policy for our state, and prepared to work with members of both parties, people from urban and rural areas of the state, to talk with them about why I think this is the most the solid course to take, and feel that the strength of this case is one that will carry the day.
Governor, from your first campaign, the Republicans made cutting Medicaid kind of one of the defining policy issues of the last decade. Why do you feel that they would turn back from that position that caused them a lot of political grief and harm? I mean, you're governor right now to do that.
I mean, I think I laid them out. I think, first of all, fiscally, I mean, if you look at the dollars of this, I don't see many. I think most folks believe that if Missourians have to pay dollars in taxes, that we should receive the benefit of that. That we shouldn't pay our tax dollars here in Missouri so that other portions of the state, other portions of the country can spend those. The other thing I think that is important for folks to fully appreciate and understand is, it's not simple, but it's important to understand, is that the ending of these disproportionate share dollars. That's a significant penalty, especially in many of the rural areas of the state where those hospitals have many challenges to deal with, and I think that's important. And then I think the economic benefit of these resources, and the ability for us to continue to have flexibility in these areas. We don't. And so I think on all of those fronts, I think that we will make solid arguments that fit within the fiscal and business models that can help us move the state forward and create jobs.
Governor